Today, I'm talking to Juliet Fitzpatrick. Juliet was diagnosed with breast cancer at the age of 54 in 2016. Since then, she has worked tirelessly as an advocate for those who choose to go flat. In other words, those who choose to have a simple mastectomy without having a reconstruction. And this was born out of her own experience, of when she was taken through her surgical treatment options and going flat was not particularly discussed. Her advocacy work has meant that photos of her flat chest has been shown all over the world on billboards as well as adverts. Most importantly, she describes how her decision to go flat gave her a sense of empowerment. We recorded this remotely, of course, due to the lockdown, and we did have some unsuspected guests making an appearance onto the show, and you'll definitely hear them as well. It was a great conversation and one that I am sure you will enjoy. So without further ado, here is my conversation with Juliet Fitzpatrick. Hi, Juliet. Thank you so much for coming onto the podcast. How are you today?
Yeah, I'm pretty good. Thank you. Thanks very much for having me.
No, thank you for agreeing to come onto the show. I wanted for you to come onto the show, actually, because you are, and you've been for some time now, a passionate advocate about going flat. In other words, for those who need a mastectomy as part of their breast cancer treatment, you're an advocate for those women to choose going flat as an option. And I think this is something that's quite important to talk about, because there is perhaps a conception out there that women need to have a reconstruction, whereas in fact they don't need to have a reconstruction if they don't want to. Yeah. Can you tell me about your diagnosis of breast cancer in the first instance?
Yes, so I was diagnosed in January 2016. It was actually followed my second routine mammogram. I hadn't seen any signs. I hadn't felt any lumps. No, I hadn't seen anything suspicious. So it was quite a shock to me to get called back to have further tests. After I'd had the further tests, I was then diagnosed with invasive ductal carcinoma in my left breast. And at the time, my surgeon thought that I could have a lumpectomy followed by radiotherapy.
Right.
So that, it was a massive shock. I'm not going to lie about that. And the treatment seemed doable, I suppose. It was okay. This will get done and then I'll be fine. So I had the lumpectomy in February, and unfortunately the surgeon couldn't get clear margins when he finished the lumpectomy. So I had to have a mastectomy, basically because the tumour was much more spread around my breast than was expected. So at that point I was told I had to have a mastectomy, and also that I would have to have chemotherapy because the pathology of my tumour, it turned out that it was HER2 positive as well, as well as being estrogen and progesterone positive. At that point, I was totally shocked and traumatised because the thought of having a mastectomy and chemotherapy, it just seemed to have got a lot more difficult for me. So, yeah.
And when they talked to you about mastectomy, obviously that, at the beginning, that wasn't really discussed because, of course, the aim at the beginning was for you to have a lumpectomy with the hope that the cancer would be able to be removed at that sitting.
Yes, that's right.
What?
Shall I shut it up?
No, that's fine. Well, what dog have you got?
I've got 2 whippets.
I love whippets. Well, this is real time, so,
Fair enough.
What are their names?
One's called Sydney, and the other one, who's the barker, is called Stanley.
Oh, hi Sydney, hi Stanley. Oh, they're so
they're
cute.
Both 10.
10.
So yes, they are. Yeah.
Oh, lovely.
They're good boys.
Oh no, that's fine. It adds to the ambience.
Okay, fair enough.
Just going back, so you were hoping, obviously, that the lumpectomy would be enough and not having to have a mastectomy. And when your surgeon recommended you to have the mastectomy, what kind of conversations did you have surrounding that?
It was, how could I describe it? It was very difficult, to be honest. He kind of just was very blunt and said, look, we didn't get clear margins and I recommend that you have a mastectomy. And then almost immediately, after he described what happened with the mastectomy, went on to say, and this, I think you can have reconstruction. I think you will be a good candidate for the DIEP flap reconstruction. So my colleague will show you some before and after photos of women who have gone through that. And then you can go off and see the plastic surgeon, and he will talk you through how that works. I think it would, yes, it was going to have to be a delayed reconstruction, because at that point they still thought I was going to be having radiotherapy. And so they wanted me to wait for a year after the end of my radiotherapy.
Okay.
And I found, I think I was very, very shocked at that point at the thought of having a mastectomy. And then when I started to be shown these photos of women who'd had a mastectomy and how they looked before that and after their reconstruction, I really couldn't take it in.
Yes.
And I really didn't, I hadn't known anybody that had had breast cancer before or had had a mastectomy. And so I had no idea about the different options, the different surgeries that were possible. So I kind of just went, okay, well, if that's what you're recommending me, fine, that's what I'll go with. I didn't really like the sound of the 8-hour surgery as he described it to me, because I absolutely hate operations.
Okay, don't blame you.
Most people do. But I thought, okay, if this is what my surgeon's telling me, then I think that's probably what I will have to do.
So you were recommended to have have mastectomy and a delayed reconstruction.
Yes.
And the option of reconstruction that was recommended to you was a DIEP reconstruction.
That's right. Yeah.
So just for those who don't know what a DIEP reconstruction is, it's basically using the fat and the skin of the abdomen. So DIEP stands for deep inferior epigastric perforator, which is essentially the blood supply that supplies the bulk of the fat and skin that you can grab essentially on your tummy. And what happened is that gets detached from your person and then reattached and replumbed, if you like, onto the chest wall to make a breast. So as you rightly said, it's a very long operation, takes about anywhere between 6 to 8 hours. So it's not an operation to take lightly. So you went ahead and had the mastectomy.
Well, I started to think it all through, actually. I went home and started feeling a little bit uncertain about whether I wanted to go through with the reconstruction. I did go and see a plastic surgeon who kind of talked me through how it would work, but I was feeling really unsure about having it.
Right.
And I knew that I didn't have to have I wouldn't have the reconstruction straight at the same time as the mastectomy, so I had some time. But I did start Googling and sort of say, I looked for, does every woman who has a mastectomy have reconstruction? And actually, I found out that no, that doesn't happen. And so I started doing a bit more research and looking into it. And over time, over a few days, I suppose, I started thinking that actually I don't think I want to do that at all. Even after a year or whatever. So I actually found a really good Facebook group called Flat Friends, which helped me to, I could interact with some of the women on there and help me to make my mind up and find out what it had been like for them to be flat. So I actually decided that I wouldn't have reconstruction at all. And before I had my mastectomy, I asked to go and see my surgeon again, and I wanted to ask him if he would do a bilateral mastectomy, because what I haven't mentioned is I did have very large breasts. I was a 34 double G cup. So
it'd be quite lopsided if you had a mastectomy just on one side. That was the worry. Okay.
It was the worry, yeah. And obviously he said no.
Yes.
Well, not obviously, but he did say no. He said, let's do the mastectomy and get rid of the cancer, and then let's we can maybe talk about it after that. So that's where we were, and I had the mastectomy, and it was traumatic.
So you essentially made up your mind that you didn't want to have a reconstruction before you had the mastectomy. You didn't need that time to consider your options.
No, I didn't. In the end, I felt quite strongly that I didn't want to have for me, what's in the end seemed to be an unnecessary operation.
Yeah.
And in fact, possibly more than one operation, and possibly some surgery on my other breast as well. And I think at the time that was what was driving my decision was I wanted to have as few procedures as possible.
Yes, and that, to be honest, that's not an unusual motivation. Lots of women who I see. Is that Stanley, or is that
that's Stanley again? I'm afraid.
Yeah, lots of women who I see, they do opt for the simplest of surgeries for many reasons, to be able to get on with their lives, to not to want to go back to hospital if they have any potential complications or wound healing problems and such like, which of course with reconstruction, there's always a possibility, because the more complex an operation, the riskier it can be. So when you decided to have your mastectomy without reconstruction, obviously you needed the mastectomy, so you had that done. How did you feel when you woke up the next day and realized that you didn't have one of your breasts?
Yeah, for me it was incredibly traumatic, actually. Strangely so, because as I said, I had very large breasts, and I didn't really like them that much because I'm quite a small person. I'm 5'2", so They always seem to be quite big for me. But when I woke up, I was really upset. I just couldn't. I found it very hard to come to terms with the loss of my breast, and I suppose it was. Didn't feel like I could look at my chest the first day, certainly. But I did have to stay in hospital for 2 nights, and the second day I did look at it, and I think the thought of what I was going to see was worse than actually what I did see. So, it was okay. And, when I got home and I was in my own space, I felt more comfortable at, trying to come to terms with it and looking at it more often. Really.
You were shown pictures before the surgery. Did that help at all?
I don't think I really saw them properly. It was at the appointment where I was told I had to have the mastectomy, and I think at that point I wasn't really seeing them. And I think what I was focusing on, rather than seeing somebody without a breast, I was focusing more on the pictures of the post-reconstruction. Right. So when they did have a breast shape again. I had seen photos of women without breasts when I looked, trying to make my decision about reconstruction. And actually, they looked, to me, they looked absolutely fine. But then when it was my own body, it seemed a lot worse.
I guess it's a different experience, isn't it? Yeah. And how did you recover from your surgery?
Yeah, the recovery was pretty good, actually. I had a small scar opened slightly underneath my arm, and I had a small infection there, but that healed pretty well in the end. I had a little bit of cording at one point. Again, I got seen by a physiotherapist pretty quickly, and that was sorted out. I didn't have a seroma, which I was really happy about.
Did you have a drain? Or
I did have a drain. Yep, I had a drain for about 4 days, I suppose.
Okay, so you went home with the drain.
I did go home with the drain, yeah. And so, yes, I didn't get a seroma, which I was really happy about. Good. And I got pretty good arm movement back, reasonably quickly. I was quite good at doing my exercises because I wanted to get back to my everyday life again. So I was happy with how I recovered. I suppose I was slightly not shocked. I was slightly surprised at my scar. I mean, it's a really good scar. It's very, very flat mostly, but I do have quite a few bit of excess skin under my arms. And I also had quite a big dog ear in the middle of my chest, which I went back and had revision on. Okay. Just under a general anaesthetic. A local anaesthetic. So the scar is pretty good.
Pretty good. Just for those who don't know what a dog ear is, it's not literally, Stanley's ear in the middle of your chest. So a dog ear, I don't know whether that's a UK British term. I'm not sure whether it's a worldwide term, but in the UK, any kind of excess skin along the scar, we call it this term called a dog ear. So that is what a dog ear is. So it's kind of an excess bit of skin. It's not an unusual thing to get along a mastectomy scar. And it usually is either a middle part of the scar or the other end of the scar. But yours was in the middle part, was it?
I had one in the middle part, and I have got some under my arm, but they're fine, and I don't they don't worry me now.
Okay.
I thought it was swelling and that it would go away, but it hasn't. So, but they're fine. I don't mind those.
Do you have any sensation at all on the chest wall?
A little bit, actually. It has come back.
Okay, that's
it has
good.
come back a bit. Yeah.
I do warn my patients that you will be numb around the tear. And it's usually forever, but sometimes you do get a bit of feeling back. So you did. So that's really good. So it's good to know that you recovered from that main surgery, which was the mastectomy for the cancer. Did you get any other treatment after that?
Yes. So after my mastectomy, I had chemotherapy. I had 4 sessions, and I had docetaxel and cyclophosphamide. Have I said that
That's
right?
Yeah, cyclophosphamide. Yeah.
Yep. So I had 4 sessions of that rather than the FEC-T. Yeah, that was really, really hard. I have to say, it was tough. I lost all my hair pretty quickly, and that's all the hair on my body. I just found it very. As each session went on, I just got very tired, quite depressed, quite low. Put on a lot of weight because you have to do those injections, don't you, and the steroids. So I did find that difficult. I think I was lucky in that I only had the 4 sessions, so it went on for 12 weeks. And then I had the Herceptin as well.
Right.
I had injections, subcutaneous injections, and that started with the chemotherapy and then carried on for a year, every 3 weeks. Right. And that was fine. I had no side effects from that.
Okay. And you're on tablets?
I'm not actually, no. Okay. I tried, what do you call it? Anastrozole.
Yep.
Yeah, because I was postmenopausal. Yeah. But the side effects, I really, really couldn't cope with those. Right. I got really stiff legs and pains and aches. Yeah. Mm-hmm. So I did tried tamoxifen. And for me, having a second menopause was not ideal. Yeah. But I mean, my estrogen status of the tumour was 4 out of 8.
Okay.
So in conversation with my oncologist, I have decided not to take any hormone treatment. Okay. And we talked about the benefits versus quality of life. And I think he was happy with my decision not to carry on with it.
So you lived with one flat chest, I guess, one side flat.
One side,
for
18 months. Yeah.
And then what? And then what happened then?
And then what happened? Well, every time I saw my surgeon, I asked him whether he would remove the second breast because I wanted to be symmetrical, and that was all it was. Both my oncologist and my surgeon have always been very clear with me about my prognosis, which is excellent. Luckily for me, they don't expect to see me again, although I'm aware it can happen. And I just wanted to be symmetrical because I had to wear a bra every day because my remaining breast was so large, and I had to have a really big prosthesis on the other side. And for me, I just didn't enjoy it. It was really difficult just wearing that prosthesis every day. I couldn't find a bra with a large enough pocket to fit it in. It always poked over the top. And then when I looked in the mirror every day, I grew to dislike that breast more and to like the flat side more. Right. So I was starting to feel a bit of body dysmorphia, I guess. And so eventually my surgeon said yes, he would do it for me for symmetry. That happened in November 2017. So two years and a bit ago now.
How was your experience with that surgery?
That was even better, actually. Right. So when I woke up, I felt quite a lot of relief this time. I immediately felt that my body I felt a lot happier with my body that time. And the surgery was more simple because the first time I'd had, a sentinel node biopsy. Yes. So I had no surgery in my armpit this time. And recovered again very well. There were no complications with the scar this time. Okay. And I had the drain again and no seromas or anything like that.
So do you think psychologically, second time round, you were better prepared or you recovered mentally, you recovered better?
I think I did. I think for a couple of reasons. Firstly, as you say, I was better mentally prepared. I knew what was going to happen, and I knew that I could cope with it because I'd done it once before. But also I think instead of me dreading the operation and not wanting it, I think this time I really wanted it. Even though I didn't want to have another operation, I knew that I really did want to have that procedure. And so, once I had gone in, had it done and woken up, mentally I just felt lifted.
Really?
Yeah. Yeah.
So that's a very different feeling which you described earlier when you woke up the first time around. Yeah. This time around you actually felt happier in yourself.
Yeah. Yeah. And it's a very strange journey that I've kind of find myself that I've gone on, because from not wanting to lose one breast, I decided and wanted to lose the other one, and felt good about it, I suppose, which sounds odd, but it was how I wanted to go forward.
Yes, and I think for you certainly, because of you're generously breasted to begin with, to be very lopsided can be quite debilitating in just doing daily activities, can't it? So symmetrizing surgery, I think, is absolutely a reasonable request, I think.
Yeah, no, it was definitely good for me.
And obviously, for somebody listening in, and they might think, well, as a woman without breasts, would one not feel that, perhaps they may lose their femininity or their identity as a woman? What are your thoughts about that? How do you feel it has impacted you, if at all?
Yeah, I don't feel it has impacted me. I still feel that I still feel feminine. I still feel like a woman. If I go out, I can make myself look, I can wear whatever I want, actually, whereas before I couldn't. But I don't think it has had an effect on me in that way. I feel more confident, actually, in myself and as a woman, because I set out to, I suppose, to be assertive in what I wanted, which wasn't something that really came naturally to me. And so from that point of view, it's made me more confident and sort of empowered me somewhat, a little bit. And I think that's kind of helped me in my whole character, actually, and sort of how I live my life at the moment as a woman. I don't see myself any less as a woman because I don't have breasts.
Do you think your surgery has actually changed you in a more positive way? How would you compare yourself before and after? Has that changed at all?
Yeah, I think definitely it has. Yeah. I like to think that by making the decision that I made, it's helped me to turn the negative of breast cancer and all that can mean into positive things for me, because I definitely do a lot more. I just live my life a bit more, really, now. I've done so many things that I certainly would not have done before I had cancer.
It has empowered you to be more positive about certain things. And definitely, I guess this leads us to a project that you were involved with recently, the #ShowUs, I think, collaboration.
Yeah.
Could you tell us a bit about that and the reason why you wanted to get involved in the first place?
Yeah, definitely. So if I just go back a little bit, after I had my second mastectomy, I wanted to have some photos taken of my new body, topless. So a good friend of mine is a photographer, and she said that she'd love to come and take some photos. So we did that, and I loved the images. I thought they were really strong and sort of beautiful and everything. So I decided that I wanted to try and get them out there so that there's more, to increase the visibility of women living without breasts. I started a blog and published these photos.
Right.
And they went, I had very good response and really positive. And I also talked about, how I felt that women should be given all of the options when faced with mastectomy, something that didn't happen with me because my medical team didn't actually ever say to me, well, you can stay flat if you want to. So I did that blog. I then did another photo shoot for another project called Behind the Scars.
Right.
And the photographer that took those photos was asked to participate in this project called #ShowUs, which is a joint venture between Dove, Getty Images, and an American organisation called Girl Gaze. And the idea behind it was to create a photo bank, basically, in Getty Images of real women. And that's all different types of women. So, different colours, different sizes, different nationalities, right, different body shapes, different abilities and disabilities.
Just essentially real women in the real world.
Real women. All real women, yeah. The idea being, and they were for stock images so that advertisers and media could use them. Instead of always going with the
predictable stock images.
Exactly. And one of the strap lines is show us more women who look like me.
Right.
So for me to be part of that was perfect, because one of the things I want to do is to increase representation of women who are living flat, so that the images are seen, in mainstream media. And, you can't be what you can't see, basically. That's one of the other ones. And, my flat image turned up on a billboard in Times Square in New York.
Oh, wow.
So that was quite surreal.
That must have been a bit weird but amazing at the same time.
Yes, both of those emotions. And then also at Piccadilly Circus in London.
Fantastic.
It was up on their big, electronic billboard, and various other places through the world, actually. And I don't know the reaction. I don't know how many, people saw it or anything, but I do. For me, it was incredibly empowering to see myself up there.
Yeah.
And I know that talking to members of the flat community, on both sides of the Atlantic, I know that women have been really happy to see someone that looks like them.
Up there,
up in lights, yeah.
Because these are images that we don't see.
No, not really. It's getting more. There are a lot more flat advocates, both here and in America, and there are definitely women who are working hard to try and increase the visibility, which is great.
That's great.
And you still have to search for them, but I think they are becoming more visible.
No, that's brilliant. And when you saw your photos up there, how did that make you feel?
Oh, wow. It was incredible. It made me feel amazing, actually. It made me feel that I had achieved something that I'd set out to achieve. I really wanted to get those photos out there of me, and hopefully to inspire, either women who are facing that choice themselves, or who hopefully won't get breast cancer, but if they do, maybe they can say, well, I saw that woman up there, she had no breasts and it was fine. Yeah. So maybe I can think about that. I'm certainly not against reconstruction at all, but maybe I can think, well, if I don't want to have reconstruction, that's absolutely fine, and that's a positive choice.
And I'm assuming that, what has happened with these images out there, and you participating, advocating positively for women going flat, has that helped you move forward?
Yeah, I think it has. I feel really happy with my body the way that it is now, and whilst I'll never move away from the fact that I've had breast cancer. It's definitely helped me to, as I said before, turn that negative into something positive for me, because I never thought I'd ever do any photo shoots or podcast, or I've done a few media interviews. I went on the ITV News live, and I've done radio shows, and these are all things that have given me so much confidence, and probably is the new me. I try to find ways that I can do more of it, and it's just this is my new body, and I think my whole me is new, and different, and a more confident version of who I used to be.
That's an amazingly positive message for those listening out there, because, there are people who may have been in your position or are in your position where you were all those years ago, thinking about whether I should go for reconstruction or whether I should go flat. And I'm sorry to hear that you were not given the option to go flat, because that really should always be an option. If you do not want reconstruction, you don't have to have it. You can always go flat, and it's a choice. And I think what you're doing to increase that awareness, to make people realize that actually going flat is okay. It is a choice. And if I don't want to go down the route of reconstruction, then I can choose not to.
Yeah. And I think I felt so passionately about that, the choice element of it, and the having all the options, that that was one of the factors that really inspired me to put myself out there, because sometimes it's a little bit uncomfortable actually, and quite vulnerable to bare myself.
Yes.
But I know that it has helped loads of women who are in the situation that I was in, and not just me, all the other women that are doing it as well, and doing it in different ways. Not everybody has to take their clothes off and have photos of themselves. There are different ways to do it, but I think, I just felt very passionately about it, and disappointed that I had to fight so hard to get what I wanted.
Do you have a message for women out there who might be listening to this podcast who are in two minds about what to do? Could you give them any advice?
Yes. I mean, everyone's very different, aren't they? And everyone makes their own decisions in different ways. But I think the main advice is to find out as much as possible about all of the options that are available. I know some women can have different options for reconstruction. So find out all about those. Also, see what you can find out about what it's like to live flat, what it looks like as well. So talk to people if you have anybody to talk to. There are charities as well if you don't know anybody that you can talk to, who will give you information and advice and maybe be able to point you in the right direction of women who've gone down all the different routes that there are. But if you can, take your time. I know that's not always possible because, some women have to make very quick decisions. But yeah, if you can, take time, then do that and research, really find out all the information you can.
Well, thank you so much, Juliet, for coming onto the podcast. If people want to find you, where can they go?
Yeah. Okay, so my blog is www.bloomingcancer.co.uk. I'm on Instagram. I'm at Juliet Fitzpatrick. No, I'm not. Sorry, I'm on Instagram at Juliet KFP.
Okay.
And I'm on Twitter, which is at Juliet Fitzpatrick.
And I will leave all of those links in the show notes as well, so people can check you out. And the Facebook group that you mentioned was...
Yeah. Okay, the Facebook group is called Flat Friends, and it's a really amazing support group for women who either have one breast or no breasts. It's a closed group. In fact, it's a secret group, so you have to ask to join. But if you Google Flat Friends, you will find the website and the Facebook group, and then you can ask to join that. And I found that incredibly important and useful to me.
Fantastic. Thank you so much, Juliet, for coming onto the show. I really appreciate your time.
Oh, that's great. It's been really good to talk to you. Thank you.
What a fantastic conversation that was. Thank you so much once again to Juliet for taking the time and sharing her story with us. Do connect with Juliet on social media. You can find her on Instagram at JulietKFP and on Twitter at Juliet Fitzpatrick. And you can also find her blog at www.bloomingcancer.co.uk. I will leave all of these links in the show notes at mybreastmyhealth.com/episode 15. So that's episode 15. If you have found these podcast episodes useful, it would mean the world to me if you could leave a rating and review on Apple Podcasts. And what this does, it actually makes the show more discoverable to people and hopefully help others.